So I welcome you here today to this spectacular, what will be a spectacular lecture, I'm sure, but also to celebrate both the advanced program that the campus has, which is a National Science Foundation. Is Carrie Ann here? Where's Carrie Ann? The school, 5 years ago, I think it was, got an NSF grant to advance women in STEM fields. And the university did something that was very unusual. It said, we're not going to worry just about women in STEM fields, but we're also going to worry about all women being advanced and being nurtured and mentored in all areas of the campus, and also those of color and underrepresented women in that. Well, aren't women underrepresented by definition, but underrepresented minorities in the campus. So the campus has an advanced professor in every school and college. And actually, I was pleased to have been appointed the first advanced professor in the school by Dean Gold. And I used to have to always start by saying, it doesn't mean I'm the oldest professor, as in advanced. Our second advanced professor was Dr. Sally Kablinsky. Sally. Our third was Dr. Sandra Hofferth, Sandy, and our fourth is Dr. Dashanka Kleinman. Yes, and we are all the old. No, we are the most advanced. The lecture is also sponsored by the division, the council, Office of. That's it. Office of Diversity and Inclusion, and Kumea Shorter-Gooden is the director of that. Thank you very much. So it's really wonderful. Mentoring is very important to everything that we do. Teaching and mentoring are two things I think that go together. And I think we advance as a school. Both Eve and I have a mentor. And in fact, everyone should have at least one or two, multiple mentors. But I think it's really a great honor today to have our speaker, but I am not going to be the one who introduces her. Our new advanced professor, our fourth advanced professor, Dr. Dashanka Kleinman, will do that honor. So first of all, I welcome you all today on behalf of the 22nd Ranked School of Public Health.
Well, I can't add to that. I do have to say that we ranked 20th if we were just to be looked at as NIH funding, so we've sort of moved up a little bit, and maybe we've met Dean Gold's goal that he set. So it is my distinct pleasure to have the opportunity to welcome a very good friend and leader among us, Dr. Joan Reede. I want to tell you a little bit about her and her background before she has a chance to speak to us. I can say with good evidence that she's an incredible innovator and a dedicated leader of stellar career development programs that span the full age span, at kindergarten through postdoctoral training. And her many, many achievements have been recognized not only by academic and professional organizations, but by her election in the Institute of Medicine. So you may ask the question of how did she prepare herself for this work? And I would say that she pursued a really rich and a very deliberate path. And I'm going to tell you a little bit about that, but it also reflects her commitment to learning, and lifelong learning as well as teaching. And with every academic step, she went a little bit further. So after receiving her undergraduate major in biochemistry at Brown University, she pursued medical school at the Mount Sinai School of Medicine, and that was followed by a pediatric internship and residency just down the road at Johns Hopkins. So she really likes crab cakes. She's a diplomat of the American Board of Pediatrics, and then went on to complete a fellowship in child psychiatry at Boston Children's Hospital, and then a master's in public health at the Harvard School of Public Health. A postdoctoral fellowship in health services research followed and got her very involved in data analysis, and then 2 additional degrees, a master's in the science of policy and management from Harvard, and then an MBA from Boston University's Executive MBA program. And if that wasn't enough, a certificate and a degree in the area of health leadership and practice. And I've asked her to take a little bit of time and tell us from this cascade of academic degree and certificate programs some of her personal pathway that she made through these academic components. Currently, Dr. Reede has 2 academic homes, the Department of Medicine in the School of Medicine at Harvard, and then the Department of Social and Behavioral Sciences at the School of Public Health. So she's really well aware of the 2 cultures that contribute to health and well-being. And she's seen health care and health professions from a variety of professions and perspectives. While at Harvard's Medical School and School of Public Health have been a predominant academic home for her, she's also served as medical director of the Department of Youth Services, the Commonwealth of Massachusetts, and as a medical director and clinician in hospitals and in community health centers. At the medical school, she's created an extensive array of programs that she formed and still leads, and some of these can address minority faculty development, of the Harvard University Fellowship in Minority Health Policy, community outreach programs, the California Endowment Scholars in Health Policy at Harvard, the Joe Henry Oral Health Fellowship in Minority Health Policy. You can see the oral health, dental health is in here. The Center for the Study of Diversity in Science, and the Program for Faculty Development and Diversity Inclusion at the Harvard's Translational Science Center. Her ability to design and sustain programs should be clear to you by now. And I'm just going to give you one example, and I know she'll speak about this, the Biomedical Science Student Conference that's held every other year, that she developed and is focused on minority high school, college, medical, dental, and graduate students and postdoctoral fellows. She launched it in 1992 with 100 participants, and by 2014, over 1,000 attend, and about 10,000 have been part and parcel of the whole impact and beyond throughout the country, and beyond the country as well, globally. Her expertise is highly sought, and she continues to give liberally of her time. And I'm just going to give you an example of some of the services she's given to NIH and the Department of Health and Human Services. She's served for the past 15 years on numerous councils and advisory boards for several institutes, as well as for the director of NIH and the different components of NIH, the Board of Governors for the Clinical Center, the Intramural Research Program, and advisory committees on genetics, health, society, minority health, the Children's Study, the National Children's Study that our dean has participated in, and working groups on diversity and more. But she has maintained steadfastly on mentoring, the topic of our presentation today, on leadership, on health policy, on diversity inclusion, and I think that we're going to learn so much from her presentation. So I want to welcome you and thank you for joining us.
Thank you very much. Good morning. So my roots are really Southern roots, even though I was born and raised in Massachusetts. And for those of you who are from the South, you might have heard of call and response. So we're going to do this one more time. Good morning. Good morning. All right. Wonderful, wonderful. Dushank, I have to thank you for that introduction. The major thing that I thought of as I was being introduced is there are people who are saying when she stands up, she's got to be like 120. I'm just going to see this person sort of creep to the front of the room. And so just a piece of this is you can do a lot if you enjoy what you're doing and if it's part of your passion. And for me, if it means you can make a difference. And you can also do a lot if you start to link things together. So as you look at these degrees, if you look at this training, they're all driven by there's something else I want to know. There's something else I want to understand. There's another room I want to enter so that my voice or the people that I care about and feel passionately about can be represented within the room. So you see a journey that if somebody had sort of asked in utero where you're going, this is not what it would have looked like. But a journey that's really been directed by keeping my eyes open, listening, learning, and working with others. And that's all you see represented here. So with that, I'm going to turn to this art of science and mentoring. I want to begin by saying I have no conflicts. If there is anyone in the audience that is independently wealthy and would like to give me conflicts because you want to support my programs, feel free. Feel free. And I'll add your name up there. Okay. So part of what I want to talk about today, understanding that there is a range in the audience from people who are being mentored and looking to how they could get better mentoring to people who are mentors, really taking a very generic approach. And what I want to talk to you about are my thoughts about someone's career development and mentoring and the kinds of things you should be thinking about, talking about, taking advantage of. And begin by saying, what are the expectations of mentoring? And it's really based on your career level, it's your interests, is it developmental, is it knowledge, skills, competence, career outcomes. I have a good friend from NIH when they talk about graduation is, are you trying to get the magna cum laude or the summa cum laude or the thank you laude? But, is it where are you trying to go with this in your recruitment, promotion, career expectations, networks, resources, confidence? What is it that you want from this mentoring? And I think one of the hardest parts of mentoring is we all expect something different. And so one of the challenges oftentimes is, for me, as I look at dyads, is in my mind, I'm thinking that this is what I'm delivering. And the other person's mind is they want something very different. So how do we start to have that dialogue so that we're on the same page? So I'm going to take an approach that says, what is the what, when, where, who, and why? And this is how I approach careers. This is how when I'm talking to somebody in high school, but this is also when I'm talking to a senior faculty member that's trying to figure out what they're going to transition to next. That I think are the critical kinds of questions we should be asking. We should help our mentees or proteges with, and what they should understand they should be getting from us. So the what for me starts with this skill assessment. What am I good at? What am I talented at? What kind of knowledge have I acquired from different kinds of education, training, exposures, experiences? What are my assets? And I'm going to come back to that. What are my assets and my strengths? And it's something that you need to determine for yourself, particularly since there are those around us who have different thoughts about what we are good at and what we aren't good at, who look through lenses that would limit where we go and what we do. So how do we for ourselves start to understand that and not buy into the false assumptions that others make about where we can go and what? So an example would be if I were to buy into a false assumption about what I could do when I was in high school and trying to apply to college, and my guidance counselor said, well, nobody from our school has ever gone there. Nobody from our town has ever gone there. Look at you. You can't possibly go to Brown. My own self-assessment and my own support system told me I could do anything. So I did something that you really shouldn't do. I only applied to one college, but I went to that college. Okay? So not buying into other people's perceptions of what my abilities are. The what is about what interests you. What do you have a passion for? What makes you want to get up in the morning and go to work or go do something? And I think everybody should be pursuing this in their career. I can't imagine doing something where I started the day going, oh my gosh, I have to go there again. I have to be with those people. I have to do that work. Right? You want something that raises you up and something that's consistent with your values. So I think you should never make choices that are contrary to your values. So what energizes you? Is it what kind of activities you're engaged in, what kind of people that you're involved with, what kind of environments? Starting to think about those kinds of things, starting to think about the experiences that you've had that can shape your what. There's this work that's been done looking at sort of 360-degree evaluations, and this comes from an article by Zinger et al., that starts to look at what makes you useful within an organization, but I think of it more in terms of how do I start to understand what my strengths are? Are there frameworks that I can use for understanding my strengths? And with this, you can do a 360, and some of us have had 360 evaluations, but they're costly. So what's the 360 evaluation on the side? Okay, for those who can't afford them, where our organizations aren't paying for it. So how do you find those above you, around you, who can give you honest input for these kinds of things? What do you think are my real skills? Asking other people. There's things that I think, but there's other things people think are my skills and strengths. Is there anything that I'm doing that's actually a fatal flaw? Okay. So think about people you know in your work environment, that you're watching them, they're good, and you're going, but that's a real problem over there. And nobody tells them. So tell me, is there something that I'm doing, is there a way I'm acting, is there a way I'm performing that really is going to hold me back? It's something I need to work on. Of the kinds of things that I'm doing, what would have the greatest impact? In terms of my field or my unit, my job, for those of you who are trying to move forward into leadership positions, what are the kinds of things that you might do that would make the most contribution to your organization? And then for the person you're talking to, of the skills and the things I have, what has an impact on you personally? Okay. How does it relate to you personally? So doing this work and looking at over about 250,000, 363 evaluations, they came up with these competencies that are 16, that sort of skill sets that people have that are really aligned with moving forward, moving into leadership, taking on more responsibility, being valued within organizations. And they come into 5 categories: character, personal capability, getting results, interpersonal skills, and leading change. But what do those look like? And so if you think about these, and I want you to look at this, I'm going to read them, but I want you to think about, if I were to ask, do you have skills in these any areas? Some of you might be stopping and saying, no, I have skills in everything. If that's where you are, back up. Because none of us have skills in everything. And what I'm putting forward here is, all too often when we're thinking about where we want to go and what we want to do, we start in a place of deficits. These are all the things I don't know how to do, or I can't do, or I'm not good at, so I'm going to work at those. Okay. This says there's things that you are good at, and it says, how do I do them better? How do I work from an asset point of view and its strength? So it displays honesty and integrity, technical and professional expertise, solves problems and analyzes issues, innovates, practices self-development. You could say 5 degrees is a little bit of self-development in there. Focuses on results, establishes stretch goals, takes initiative, communicates, inspires and motivates, builds relationships, develops others, collaborates, fosters teamwork, has a strategic perspective, champions change, connects the group to the outside world. If you look across this and you look at people, there are pieces of this that some of us are very good at, and some of them that we're not. How do we start to think about these? How do you choose a strength to focus on? And part of what I'd say is, in choosing the strength you're going to focus on, is what do you think you're good at? As you do this 360, what are other people telling you that you're good at? What do you have a passion for? What do you really like to do? There's things that I'm good at that are chores that I really don't want to do. And this passion, do you look for ways to enhance it? Are you energized by this? Do you feel exhausted? Can you imagine devoting time? I mean, there's things that I do, and there's things that we all do. There's somebody saying, well, why are you in the office late, and why are you coming the weekend? Because I like it. I'm not tired from this. I really like this, okay? And does your organization need it? So you're putting those things together to figure out what kinds of strengths you want to work on. So if you thought about solves problems, analyzes issues, something I love. I love big problems. and building relationships. I love collaborating and working with others and working through relationships. How do you start to understand what makes up those strengths? What are the complementary behaviors, the things that I need to work on? And in this article, what they start to talk about, solving problems is not just, I'm going to get better at solving problems. But what does that look like? Do you take initiative, organize and planning, decisive, innovate, tackle challenges, strategic perspective, act independently, technical expertise, communicate? So what you're looking at, what are the components of that skill? And what you're able to start to say, some of these things I do really well, and there's some that I don't do well. And the ones that I don't do well on, how do I improve them? So say if you were talking about this ability to communicate powerfully and broadly, and you don't do as well, is it that you don't do presentations? Is it that you're not concise? Is it that you're not clear? Is it that that you are not in your working, or you're not a good writer? What are the components of that you start to work on? Where I think this is helpful is a student, a faculty member comes to me and it's very broad. How can we start to hone in on what are the things that we actually need to work on across the board? Across this path of the what to is how we define success. And I'm in an academic environment, and too often in the academic environment, we define success as I move from instructor to assistant to associate to full professor to department chair to dean to president to head of the universe. Not university, universe. Okay? Right. This movement and getting ahead, but not everybody defines success in that way. Is it feeling secure? For me, success is much about this getting free and getting high. All right? I like autonomy. I like to be able to tackle things and come up with new ways and new approaches. And getting high, I love problems. Give me a big problem and pull people together and let's just go at it. Okay? That energizes me. So in an academic environment, as I talked to my mentors early on, and they were coming and they were saying, Joan, you know, what you're doing, you're not going to get promoted doing this. And my response was, well, I don't really care because I'm happy. I feel successful. And then it was reframed for me. They said, Joan, you do understand that if you get promoted and you advance, you will have more autonomy and be able to take on bigger problems. At which point I said, well, then that's a reason for me to be promoted. What motivates us is very different, and our idea of success is very different. It's going to be unique for each and every one of us. This idea of getting balance, I think everybody should be aiming for it. Anybody who thinks they're going to have this perfect world where my family and my emotional and my personal self and my work, it's something to strive for, but don't lose sleep if you don't have it, because nobody in this room has it. Okay? People sort of say that that's what you should have in life, but life changes. You change, and your needs change over time. This other part of this idea of moving forward is start to look at careers, and as you're talking to other people, start to look at their careers. It's not always moving forward and up like in a hierarchy. Sometimes it's moving laterally. Sometimes it's saying, I'm on a dead end here and I need to switch to something else. Or I found that this isn't what I really like. There's something else I like better. So it's moving vertically. It's moving laterally. And part of this, and what you see is sometimes it's moving out of the organization. And all too often we get wedded. We get wedded to our department, or we get wedded to our institution, and we feel hampered and bound in. So sometimes we have to look beyond when we're thinking about moving forward. This idea of when, and I alluded to it when I was talking about our needs and our change over time. Careers are not static, they're very dynamic. Our interests change over time. The environment changes over time. I've been interested in issues around health disparities for the longest time. And if I look back early on when I was working with NIH and as health disparities, it'd be people like saying, what are you talking about? Like, why would we fund something like this? Well, if you're doing health disparities now, it's a very good thing because they're funding it now. The environment changes. The environment changes even in terms of the grants world, in terms of you had low funding, then you had high funding, then you have low funding from NIH, okay? That is shifting all around you. But not only is that shifting, we're shifting. So you know I'm a pediatrician. So we're starting in the stroller, and then the tricycle, then the bicycle, then the sports car, then the two-door sedan. I drive a four-door. And then the wheelchair. And this is just this idea that as you move through your career, your priorities will shift, your interests will shift. And how do you give yourself, how can you be kind enough to yourself to understand that? So as I think about this and these career stages that you move through, early on in my career, my priorities were my daughter and my work, but my daughter was always first, my family obligations, with a clear understanding that she should graduate from high school and move on. So then I could get in my sports car and drive off. Okay. For anybody that's a parent, they never move on. They are there. And now I'm in my sedan with my grandchildren and enjoying every minute of it. Okay. But you go through these stages in your career. So it doesn't all have to be done at one time and in one way. The where, this is the iceberg. And you know about 90% of the iceberg is below the water, 10% is above. This is how I define our organizations. There is so much that is not written and not understood, and what are the rules of the game? And so there's the rules that's written, and then you have the conversation of how does it really work. Okay, so if you think about promotion and tenure, if you think about advancing how you navigate within an organization, talked about the skills before, but this is how it relates to organization. A strength you feel passionate about that is not important to your organization is essentially a hobby. And a strength the organization needs but you don't feel passionate about is just a chore. So how do you bring these two together? Where you are working, the environment you're working in is critical. So it's not just do I have the strengths and I have this passion, is it recognized where you are? So if you think about the units where we're working, for me in academic medicine, clinical care, research, teaching, administration, service, how is this work valued in your unit? The where is critically important. And sometimes what I see is I'm talking to faculty and I'm talking to people, they feel like they're bumping up against a wall. And part of it's because they're in a place that doesn't value what they do. And then you have to ask, what is my idea of success? So for me, if I'm still having a good time doing the stuff I want over here, there's a part for me that I actually don't care about that validation. But if you really know me, what I'm actually doing is trying to change the whole system so that the system will value what I want. But I understand that as I step into that space. So in the organization, for me, I start with autonomy because I love that. I love to sort of step out there and do something that's different. But as I think about my fellows and I think about my junior faculty who are given these wonderful titles, and I'll say, so what came with it? I'll say, do you have an office? No, not really. Do you have a secretary? I share it with 10 people. You know, do you have a computer? Do you have staff? Do you have resources? Things, particularly as you're starting out, people don't necessarily think about that are critical. Some things that you take for granted that may not be important. Do you have a parking space? All right. Sounds not big, but for me it was critical that I had a place where I could park that was close enough to my office so I could get in and out, so I could pick up my daughter at school at the end of the school day. I mean, just real practical types of things. Are there opportunities for promotion, for strategic assignment in the organization? So one of the things that often happens is we get asked to serve on a bunch of committees, particularly for women or people of color. You can't say no to everything, so you have to be strategic about what you say to no to. So what I consider a strategic committee for me is this a committee that sets policy? Is this a committee that allocates resources? Is this a committee where I can understand better how this organization functions such that I will be able to understand how to position the things that I'm doing? Is this a committee where I can gain visibility with the people that I need to know that I am here? Because a lot is done through networks and connections and being seen. So being off in the corner by yourself is not a good way to maneuver into positions of leadership. Is this a place where I can identify mentors? Is this a place for self-promotion? One of the other things that happens is sometimes we wait for someone else to recognize us. And what I say is if you're a person of color or woman and you want to be on that committee or you want to do certain things, you have to speak up. People are not going to just sort of know, sort of like I looked at you and I realized that that's what you wanted to do. You have to be able to voice it. You have to be able to speak up. And I think about important things that I have been able to contribute to because I spoke up and said I want to be on that. You have to figure out when and where. An example would be they were looking at a committee to look at the promotion policies of our school. I wanted to be on that committee. There were things that I thought were important. So there's a part where I can have a private conversation with you, or there's a part in a public meeting where I can say, I would really like to serve on that committee, so that everybody saw that, and I served on that committee. And they're doing wonderful things that they never thought they'd be doing in promotion. Is there opportunity for stretch assignments to take you beyond what people think you can do, or for management training, management and leadership training? One of the things that often happens in our institutions, particularly academic institutions, not so much in industry, but in academic institutions, the way you move into leadership positions is often because of your excellence in scholarship. But excellence in scholarship does not mean that you know anything about managing anything. Not your Jean. She's excellent at everything. But why, because you know how to do this and get this grant and write this paper, do you think you know how to run an organization and work with people? All right, so how do you get that management training? The who. When you see a turtle on the top of a fence post, remember that he did not get there by himself. Do I need to say anything else with this one? So the who for me is thinking both inside and outside of your organization. Who are your supports? Who are your networks? I'm going to talk a little bit more about that. Your role models, your advisors, your mentors. Lots of different types of terms that we put out there for that. And I'm going to talk to you a little bit about this concept of mentors and of networks and networks of mentors, developmental networks, because I think that's important. And part of the reason I think this is important is I don't think that there's one mentor for life that's perfect. That's your spouse or significant other. And we don't even do that right. Okay? Right? You may need different people at different points in your career. You may need more than one kind of person at any given point. It depends on what you're seeking and the outcomes that you're seeking in the mentoring. So the traditional mentoring that we talk about is often in terms of dyads, and it's this dyadic relationship. It's hierarchical because a senior person is mentoring a junior person. And I think that's important. But I believe in this building networks of mentors where there's some reciprocity, and you are giving to the mentor and the mentor's giving back to you, all at one time serving multiple functions. So people who are in these networks, and I know oftentimes we talk about networks and networking is a bad thing, but I don't think it's bad, who have effective networks and who are high performers, are connected to information, internal and external, best practices, contacts in terms of what they're doing, getting feedback in terms of as they're making decisions or pushing horizons, connected to people who can provide political support, resources, and other kinds of things. We don't do it alone. So as you start to think about these networks, who are the people that can connect you here? But also there's a part of this about people who are networks who have a high degree of satisfaction in the work they're doing. And they have supports from family, friends, colleagues. If I had to say anything about my network and my ties and if I said my developmental network and my mentors, my family's right in there. My mother and my grandmother, people who absolutely believed in me, people who supported me in my decisions, but people who were also there to be able to pull me back and tap me on the shoulder and say, all right, Joan, it's not about them, this is about you. Okay. So this support group, people who will validate your work and your sense of purpose. So for me, it's the people, as I was starting to do something, and I talked a little bit earlier about something I was starting to do, and people called it Joan's fantasy at Harvard. It's like, this is never going to happen. And they wouldn't even acknowledge it. It was just Joan's fantasy. Well, that's the Biomedical Science Careers Program. It's the organization that Dushanka alluded to that's had over 10,000 students come through it. It's now 501c3. Okay. But there were, just as some people were saying it's Joan's fantasy, there were some people who were saying, we believe in you. Don't quite get what you're trying to do, but we believe in your ability to make a change, make a difference. And this other part, who promote physical, mental, and spiritual health. I believe we can't be all that we can be, and we can't achieve our full potential unless we're able to pay attention to all of these at the same time. So this is a little bit about networks and the skills we bring to that, and our capacity to take advantage of the networks. And so for me, it's what are the skills that we have? What's our interpersonal style? Do we view making these connections as opportunities or as threats? So are we hesitant? Do we pull back? Do we not talk to people? Do we think of them in terms of helping us to get to our goals? And how you position or think about these connections is going to have an impact in terms of how you use them, how you recognize what they can bring to you, and how you can move forward. So this is about what they call network traps. For people who say they don't like networking, and I think these are some of the reasons. So think about people you know as they build their networks of supports and other kinds of things. The formalist, it's the hierarchy. I'm only going to work with people who are higher up. What do you mean you don't have a degree? What do you mean that you don't have the right title? Okay, I'm only going to talk to people up here. I need the hierarchy behind me. The people who are bottlenecked, it's I'm going to work with the top person here and the top person here and this person there and then that person there, and you're spending so much time networking with all these top people that you get nothing done. Okay. Think about the wrong kinds of relationships, and I do a lot of work around diversity. So this what they talk about, this disconnected expert, it's I'm going to mentor, I'm going to be mentored by and have a network of individuals who are in my field, only in my field, and only in this bit of my field that I share. So there's no one that you're working with, there's no one you network with that can push boundaries, that can ask you to think differently. That's part of what diversity brings. Different frames of reference, different perspectives, different heuristics. So you're staying safe, but you're staying in one place. Okay? The bias leader. I'm going to go work with people and be mentored by and build networks with people who share my culture, share my background, share my beliefs, share my values, because they're right. Okay, right? So I'm not working with people who are going to challenge those beliefs and help me to grow. The wrong behavior, the superficial networker. My network with you means, hi, my name is Joan. We're not network. Hi, my name is Joan. We're not network. It's superficial. There's no depth. There's no substance to it. And this other one, the chameleon. Hi, my name is Joan. Hi, my name is Joanne. They're changing who they are. You don't know what they are and what they're about. This is part of the problem with building these networks. Okay? So I want to talk a little bit about how you find the right mentor, but I also want to share with you a little bit about these networks and connections. So our office, my office at Harvard Medical School, is the Office for Diversity, Inclusion, and Community Partnership. We call it diversity inclusion, not diversity and inclusion, because much of the work around diversity, there's minorities, and then there was diversity. Now there's diversity and inclusion. And oftentimes what we do when we talk about diversity and inclusion is we count numbers. And in our organizations, in our units, in our departments, we celebrate big. So think about any of your units or departments. If they said, we've had a 100% increase in minority faculty, underrepresented minority faculty, all right, that would be a banner. Does anybody ask the question, what was the baseline? Right, 1 to 2, 2 to 4. And when you went from 2 to 4, nobody says, are those same first 2 still there, or these are a new 4? Okay, all right. So we're counting numbers. All right. Inclusion, it's I'm being valued within an organization, and completely important. My job in my office, in Office for Diversity and Inclusion, is how do I embed diversity in the organization? So as we think about our policies, our practices, our procedures, where is diversity within that? Diversity is not owned by me in my office. It is shared, and responsibility is shared for across the organization, because there's a sense that in achieving diversity will increase our capacity to meet our mission. Diversity enables us to achieve excellence, and without it, we can't. It's a very different kind of positioning. Diversity is about capacity building. Diversity is not about I'm black and I'm a woman. I am that, and I am so much more. So when I am, or others, or you're in the organization and someone looks at you and they say, well, Joan is here now. She can clearly tell us about minorities, clearly all minorities, because once you're a minority, you know about everybody, okay? And I can tell you about women sometimes, but oftentimes not, because I think if you know about minorities, you don't know about women, because this intersectionality, they can never bring that together. And I'm in there saying, oh my gosh, I've had all this training and education. It's not really valued. They think the only thing I am is a black woman. How wedded to that organization am I? How valued do I feel in that organization? Now, to the flip side of that from the organization, I'm an asset. I'm part of the human capital, the intellectual capital, all of those of the organization, and you're leaving that on the table because you're not recognizing the full dimensions of diversity that I bring. And understanding that everyone in this room, everyone in your organization brings some dimensions of diversity. Diversity is not just about race and ethnicity. It's not just about gender or sexual orientation or gender identity or disability or ability status. It's about all of us together. So one of the things that we did in looking at this is saying, how do we bring more data? So I'm clearly not a data wonk, but I'm a person that says, how do I know what to do if I have no data in front of me? I'm just sort of shooting in the wind. And most diversity efforts are done around with shooting in the wind. You have no data, but it feels right. And then I have no outcome data. And then the funder says you have no outcome data, so we're not going to fund you anymore. Can you come up with, it's a cycle, right? It's sort of like community programs too. You do the program, you know, evaluation, you have no data, so you stop the program, you start all over again. So what we did, and it was through a Pathfinder grant at NIH, is say that with this diversity and inclusion model, how do we have data that help us understand better how people are embedded and connected within an organization? What are the networks that they're working with? And so built something that is able to capture both public data and our administrative data to start to look by department, but also by individual, in terms of metrics that relate to productivity, metrics that relate to advancement, metrics that relate to retention, how people are connected within the organization. So if you look at co-author networks, so these are co-authors are the people when we're just looking within Harvard, so how are people connected within Harvard, diversity and inclusion within Harvard Medical School. Co-authors, and then you can look at co-authors of co-authors. You know, like 6 degrees of separation, this is 2 degrees of separation. What we found that the networks of women were much less than the networks of men across all academic levels and across all age cohorts. We found that the networks and co-author networks of underrepresented minorities, Black, Hispanic, Native Americans, were less than those for Asians and whites across all academic levels and across all age cohorts. So somehow how they're connected in the organization is different. But we also found that some of these connections and other things differ by discipline. Then you start to say, but does it matter? All right, the connections look different. The networks look different. How people relate within the organization look different. So we built a cohort and looked over 4 years with people who started at one stage and said, did they get promoted 4 years later? So we're looking at instructors to assistant professors to associate professors, and you throw everything in there in the mix. What kind of degree do you have? What kind of discipline in you? What kind of training, and where did you train? Do you have first and last author publication? What's your H index? All of that's thrown in there. And when you get through people who are in the fourth quartile, the most networked individuals, 3 times more likely to be promoted from instructor to assistant professor, 2 times more likely to be promoted from assistant professor to associate professor. Somehow, how we are connected within an organization makes a difference. It starts to be related to how does information flow within an organization? How visible are you within the organization? What kind of opportunities are made available to you within an organization? So we now have an R01, and we're starting to look at how do people build those networks? How do these kind of co-author networks relate to mentor networks? and what is it that they bring to the individual, so that we can then start to design interventions around how do we help people become more networked within the organization. So networks do matter from that part of the study, but how do you find the right mentors? And so this is very briefly around same group mentoring, and it's actually an article that just came out about part of this. And what I want to put forward is 4 areas in terms of perspective. Maybe if someone is from the same group, they'll have greater empathy. But if they're from the same exact background, the same group as me, will they be able to offer me a different perspective? So maybe some of this, having this difference, this diversity, allows me a different perspective on what's happening. So for me, it's that idea of something happens, and I literally sit there saying, all right, did that just happen because I'm black? Did that just happen because I'm a woman? Did that just happen because I'm tall? You know, what is the ism that's going on at this point in time? And someone who is more like me may be less able to help me understand another perspective. It may be that everybody gets treated like this within the group. Okay, this networking, more close-knit, but if I'm not expanding beyond my network, what am I missing out in terms of flow of information? Power, it's changing, but it's changing ever so slowly, so that if I say as a black woman that I want in my organization to have black women mentor me, how many of them are in the powerful positions? So I'm often then finding my information from people who do not have that same level of understanding in the organization. So sometimes I have to reach out beyond that. Okay. And then role modeling. Part of this takes into consideration, if I say I need somebody who is like me, I need an African-American woman with a pediatrician trained in child psychiatry, who has a public health bent with a business background, who's in administration, and who's a single parent. I mean, let's go through the whole thing. And when I get through, the only person in the country who can mentor me is me. So what is it that you're actually looking for in this? So in these developmental relationships, they talk about in network language, and I think this is a nice way to think of it. They talk about network range. So if I have 4 people, are they in different disciplines? Are they in different units? Are they able to expand my understanding and my information flow? So that's range. So I want a broad range. Density is I may have 4 people in 4 different disciplines, and we all study the same exact thing and do the same exact thing. So it's very dense. But am I bridging into other areas? So starting to think about the people that you're working with and the network that you're building. And then the relationship strength. And this goes back to this issue of superficial versus strong ties. Strong ties in developmental networks, strong ties in terms of mentoring and how you communicate and reciprocity. So some of the issues that I think are important, I start with reputation. So if someone's being indicted, move on. What kind of experience do they have? What's their expertise? But it's also based on what is I'm looking for, right? I'm trained in pediatrics. A lot of my work is around workforce development. I do a lot of survey and other kinds of things. Am I going to people who have those kinds of expertise that I need? Where are they in the organization? For me, I have a huge, what I would call a mentor network. I want some people who actually understand the rules of the game, who can promote me. Not just promote in terms of write my package for promotion, but so much happens in the world because there's somebody in the room. When someone says, I need somebody who knows X, somebody in the room can say, I know Joan. That's how a lot of things happen, right? Through the people that you know. Somebody who's accessible. One of the things I often find with some of our, particularly the younger people and some of our junior faculty, they'll say, I want this person to mentor me because I just know they're just wonderful. They have 500 publications, and they're just marvelous. And I'll say, have you seen them? And they'll say, no. Okay. Are they accessible? It's wonderful if they have those reputations, but are they accessible? And then I'm going to put forward, when you're thinking about who you might approach to be your mentor, do your homework. And I often get told that this is asking too much. Okay? This is talking to other people that they have mentored And how do they mentor? Okay. Are you satisfied? Are they open? Are they thoughtful? Are they sensitive? Are they sensitive to difference? And all of those kinds of things. Do they actually promote people on, or are they filling their lab with them? And they never move on. Are they on their 15th postdoc? People tell me it's too much work. And then I say, you're going to buy a new car. And they say, well, I have to get consumer reports, and I have to think about my family, and I have to think about my needs, and what's the best car. And we'll do all this work about these consumables. And when it comes to our career, we do not step back and put that same kind of energy into who are we asking and why are we asking and what do we expect out of it. Qualities. For me, people that will maintain your confidence, who are open and honest, who are active listeners, who will share information, who will motivate you, when you're down and you're in that place and you say, I tried this experiment for 5 times and it never worked, and say, get back in there. Okay. What have you learned from it? How can you modify it? And people who are equitable and fair. So building this network of mentors and people can help you. How do you identify what you're looking for? How do you do this analysis of your needs? How do you de-layer? And for me, this is critical. How do you take away the people who de-energize you? And we can all think of people who, after you go talk to them, you just want to go in a closet and cry. All right. How do you get rid of those people? All right. Or minimize their capacity to bring you down? And acknowledge that that's what's happening. One of the things that I see sometimes is we don't even name the elephant in the room. We don't even say that that's what just happened. Recognize it when it happens. How do we diversify this pool of mentors in terms of the kinds of things I've talked about, so that we're not just talking to people who look like us, sound like us, do what we've done, and don't enable us to grow? And this last part here is, how do we make sure that whatever they're doing for us, when we ask somebody to mentor us or to work with us, we are as willing to work as we're asking them to be. Okay? We're willing to put in that energy to make a difference, to use what they've shared with us to move something forward, and understand that we need to give back to the mentor. Okay? That doesn't mean you put them as first author in your paper, but you're giving back to the mentor. And for me, I have an expectation that you will mentor someone else. You're asking of my time, and I'm giving you my time, but I expect you to help someone else when they come and ask you. That there is a responsibility that comes with this mentoring. So I come to this last question, and to me this is the most critical. It's, how would you like to be remembered? What have you dreamed of contributing? Looking back on your life, what have been your major contributions? What is the why for what you're doing? What do you want your life to be about? Critical. And I think sometimes we get so caught up in the game that we don't step back to understand why we're in the game to begin with. Right? The real voyage of discovery consists not in seeing new lands, but seeing with new eyes. Chance favors a prepared mind. Anticipate chance events. So when I talk about these questions, the what, the when, the where, the who, the why, I actually think these are things that you should be thinking about, that you should be going over with your mentors, so that when something comes up, you're not just flying by the seat of your pants, but you've actually taken these things into consideration, so that you make decisions that are informed. Thank you.
Wonderful. We have time, thank you very much, for some questions or thoughts. I feel them in the room.
Hi, I'm Rebecca Pullman. I'm a graduate assistant in the Office of Faculty Affairs, and I'm a doctoral student in the College of Information Studies, and I'm studying mentoring as an information process. I'm hoping to get started on my dissertation pretty soon. And I was struck by what you said about feeling whether the organization values what you're contributing. And in my work, I've been studying mentors and the ways that they share information. And I feel that sometimes mentors around here, I mean the campus in general, not the School of Public Health, are in a place that doesn't necessarily value what they do. And so I'm wondering if you have any thoughts about how a mentor might move past that. You know, how do you, as a mentor, I mean, because I'm looking around and I'm seeing a lot of people, at least in this section, who are mostly mentors, not proteges. How do you move past that? How do you find the strength to go on when your unit or your organization isn't really making a priority of mentoring?
So, a few things on this. So I'm going to say this tongue-in-cheek. Not all should go on.
Yes.
There are mentors. There are, but anybody that's a pediatrician, there are dementors. Okay. All right. Think about Harry Potter. There's this array of mentors, so you don't actually need everyone to go on. So there's a part of it for me of, for what I call good mentors, there is a satisfaction in something they get from that mentoring process. And for me, in an academic institution and profession, so much of professionalism is about how I apprentice or train under someone else. I've done that, and I'm expected to do that for someone else. So that's what I call inherent, and that should be a part of it. And it's up to the individual, and it depends on the time they are in their career in terms of how much time they have and what they can give. It depends on how they've been mentored and what it means to them. But I want to turn to a different side of that. So not what can the mentor do. I want to turn to what the organization can do. Right? Because individuals, these faculty, work within an organizational setting. And the organization sets the tone for what is valued and what is not valued. And if the organization wants faculty or individuals to mentor, if they want a culture that raises mentoring up, then the organizational leaders need to raise mentoring up. And it needs to be said, it needs to be said often, but it needs to not just be said, the actions need to follow what's being said. So it's not just what the mentor can do, it's what the organization can do. And if you value it, and I would say that there is no organization that can thrive if there's no mentoring. Not an academic organization, not a research organization. It's a critical component of success. So how do you raise it up? How do you reward it? How do you identify excellence in it? And what does that excellence look like in your institution or your organization? What are the expectations of it? What are the expectations across multiple levels? Are there expectations for people who head departments, not just faculty? Okay. Are there expectations across multiple levels? Are there expectations of mentoring that's not just for the entry-level person? So we mentor and we say this person's just come into the organization, we need to mentor them. All right, we've mentored them for a couple of years, they're on their own. Does that make any kind of sense? Okay? This is career, across a trajectory. So what are the things that are in place that continue to support and mentor people as they move forward? But that means you're going to have more and more senior people who are going to help these individuals as they advance. How do you recognize that across different levels? So I think there's a part of your question that's right about what are the motivators, what are the incentives, what are the things that keep mentors in the game, get them in the game or keep them in the game. And that's actually an area we're actively writing a proposal for right now that I'll get back to when I get home tomorrow. But what is the organizational doing? And is it setting the stage for this to be an important part of the institution?
One more question. Hi, I'm Raluca Roshka. I'm a lecturer in mathematics, but I'm also involved in a program called GEMS, Girls Excelling in Math and Sciences of Prince George's County, where we have undergraduate students going into 3 middle schools and working hands-on with girls and supporting them in being involved in STEM fields, moving forward into high school, into college. And we always talk about what our programs does for the middle schools. And I keep thinking that this program does things for the undergraduate students as well. So from what you've seen, what you've read, what you've observed, being a mentor, how does this contribute to the retention and the satisfaction of the mentor?
So I'm going to give you a slightly example from my biomedical science careers program. So if Dushanka was a faculty member that was there, although she could be from industry, she could be from anywhere, from all over. So the most bizarre one we had was a student that was really interested in journalism and loved science, and we had a science writer from the New York Times as the mentor that was there for them. So it's really about the student's career interests. Dushanka would have probably a high school student, and maybe a college student, and a dental student, and maybe a postdoc that would be assigned to her all at once. And she'd know about them. What happens when they come together? That high school student is looking at Dushanka going, gosh, she's on that pedestal. I'll never be there. I can't do that. She believes in me, and that's good. The college student is going, let me talk to you about how you get in college. Okay? In the totem pole, wherever they are, they're on the bottom. But all of a sudden, they're in a place where they're not on the bottom. They have achieved. They have information to impart. You have a high school student going, my gosh, you got in that school? How did you write that essay? How did you package yourself? Think about it translates over. You have a college student who's saying, I want to be a dentist, but I'll never get in dental school. The dental student says, let me help you understand how I did it. Let me help you understand the connections. So a part of what happens in the way we've structured it, it's acknowledging the accomplishments of people where they are. And saying, you have, again, these networks, information to impart. You are important right where you are right now. Okay? So their self-esteem is built, this understanding that I have something, but there's also more for me to learn and more places for me to go, is built into the program.
Stephen, and then we're going to come to a close. I could see we can continue on a long time. So.
Just a very, very quick observation. Dr. Gold and I, we were really paying attention, but we were tweeting from here. And you should know you have some new Twitter followers. So.
I thank you. So you have to understand, so I have a Twitter account. Anybody that tweets me, if you expect a response, you will never get it. I have absolutely no idea how it works. I was someplace with some of my fellows who realized I did not have a Twitter account and were appalled. So they took my phone and they established a Twitter account. They found some picture and they put the pictures out there. They put it on the account. And then any tweets that have been sent from my account since that is because a fellow took my phone. And there's sometimes there's something that comes in that says that you have a tweet. I don't even know how to get it. So maybe before I leave here today, there will be somebody who will come and give me a quick lesson in how this works. So anybody that's following or looking, thank you very much. If you're expecting any response back from me, I am so challenged and need help.
There's a nice discussion going on right now on Twitter about this session. My question, so thank you for a wonderful presentation and especially for shining light on the institution. So here's my question. And these are maybe some of the unintended consequences. Mentoring now is a big thing from the very top. How do we make sure that mentoring doesn't turn into simply monitoring? We have cohort differences. The young faculty now are getting more mentoring. Some of the senior people maybe came through the tour mentor model. How do we make sure that mentoring is not seen as coddling? And how do we make sure that the issue of independence is not undermined with some of the networking and mentoring you've described? These are issues that we face when they actually come up for promotion and tenure. Can you speak to that?
Sure, because it's a final question, and Dushanka's trying to close this, and I have 2 minutes, and I can answer all of that. Some of the things in terms of mentoring, there are movement underfoot to better capture if people are mentoring or not, and so we're capturing information. There's forms and things that we fill out. I consider that fundamental, basic entry level of what should be monitored within an organization. It tells you nothing about quality, and it tells you nothing about content. Okay, but at least that's a page that says, I'm going to hold you accountable. And in our world, if I'm not held accountable for anything, I'm not going to do it. I'm going to do the other stuff that I'm going to be held accountable for first. So that's the first level. There's another part of this of how do you start to tell people what excellence and good mentoring looks like for your organization. And that's got to be unique to your organization. How do people come together? And then how do you raise up examples of that? So one of the things is we have mentoring awards that are not based on the number of people on your CV you say you mentor, but really based on the kinds of information, and we have write-ins and nominations. And so we may receive 500 nominations for people around mentoring, and we're reading them. It's a stack like this, and you're reading through what's being said about people. There's a part of this of, if you say it's valuable and important, does it count? So for me, it wasn't just, do you have a mentoring award that says these are the kinds of things that we think are important, but if you look at our promotion policies, getting the mentoring award counts towards promotion. Being nominated counts as evidence of excellence in mentoring, not just counting a number of people. We have established a council of mentors. So how do people that we feel are excellent mentors, how do they train other mentors, and how do they help us think about how we make our institution a place where mentoring is valued, and it's an organization where mentoring is raised up. So there's a body of individuals who have won this award, and the award is based on what our faculty feel are excellence in mentoring. So it's their criteria who are setting the stage for that. So those are some of the kinds of things I think you can do that moves you towards excellence, that moves you away from just counting. And the other part for me, because I oftentimes have people come to me and say there are these people who are there that don't get it, don't want the system to change, they're getting us stuck, they're saying those kinds of things. And my response is, the dinosaurs are also extinct. Okay? All right. This too will pass. Thank you.
Well, to that last point about the organization valuing mentoring, we really appreciate this. I hope this is just the beginning of a continued dialogue. I love the concept of a council of mentors. So on behalf of the school and all of the tweeters in the room, we tweet them a gift. Thank you very much. Thank you.